Hi, my name is Leah Poe, and I'm going to be demonstrating urinary cath insertion on a female client. The first step I want to do is look at the orders and verify that the provider has placed orders for an indwelling urinary catheter. Once I have done that, I can go ahead and gather my supplies, which I have here. I have my cath kit, I have my supplies for pericare, and I have my gloves. Then I'm going to knock on the patient's door, introduce myself, and wash my hands. Hello, my name is Leah Poe. I'm going to be your nurse today. Once I have done that, I'm going to say, for your safety, can I please get your name and date of birth? When she gives me her name and date of birth, I'm going to verify on her armband or on the orders that I have that this is in fact her that we're doing the procedure on. Once I have done that, I'm going to provide for privacy, and I'm going to explain the procedure. Ms. Smith, your provider has ordered an indwelling urinary cath insertion, and then I'm going to ask her, are you allergic to any latex, iodine, or shellfish? If she says no, then I can go ahead and proceed with the procedure. If she says yes to any of those, I need to look at my cath kit and see if she's allergic to anything and see what is in the cath kit. There are latex-free cath kits. There are cath kits that don't have iodine at all. So that is very important to do. Then I'm going to set the bed to a working height, and I'm going to wash my hands again, and I'm going to put on my gloves. So once my table is at a working height, I'm going to assist the patient into a supine position with her legs slightly spread and her knees slightly bent. Okay. Then I'm going to go ahead and expose by lifting it up, but I'm giving her a little bit more privacy by placing a drape over her stomach. Once I've done that, I'm going to make sure that I have adequate lighting, and then I'm going to go ahead with pericare. So I'm going to go ahead and put this on. I'm going to spread the labia. I'm going to go ahead and go around and down. I'm going to change it. And then I'm going to go the other way, around and down. And then I'm going to change it, and then I'm going to go right down the center from front to back. So each wipe is going to be from front to back. Once I have done that, I can remove my gloves. Okay, so after I've done pericare and removed my gloves, I'm going to go ahead and wash my hands again. And I can open my catheter kit. So I can open this up and put that in the trash over there. You're going to want to make sure that everything is to waist level. I'm going to save this wrapper so I can remember what size catheter it is. And I'm going to open my kit. So how I want to open this, I want to make sure this flap right here is facing me. And the way I'm going to open it is away, side, towards me. So I'm going to go away first, make sure that I don't cross over it. And then I'm going to go to the side. And then to this side, making sure that I leave a 1-inch border that I can touch around. And then I'm going to take this and go towards me. And then I can go ahead and turn it if I need to, only touching the 1-inch border around to maintain sterility. So then I'm going to go ahead and take my gloves out, and I can just place them right here on the side, and then I can take this top drape right here and I'm going to put it on, do that shiny side down. So I'm going to go ahead and pinch just the 1-inch border around the straight, and I see shiny side down, making sure that I'm not hanging over my sterile field. And then I can go ahead and do this and lay it like this on the patient. So the reason why we're laying it like this is because you don't want to be over any part of the sterile field. So once I do that, I can move on to putting on my sterile. So how I'm going to put my sterile gloves on, I'm going to go ahead and open this up. And then these tabs I'm going to flip open so they're nice and straight. Sometimes it's really hard to do. And then these tabs, because all this is 1 inch, so you can touch it, are folded open. And I like to slide my fingers down the thing. Make sure you're not leaning over, so my body is like way far away from the table. And I'm trying not to lean over in my field. And then I go ahead and flatten it by only touching the 1 inch border around the gloves. I'm also making sure that I'm far away from my other sterile field that I have. So I'm going to do the right hand first. I'm going to go ahead and I'm going to put this in there like that, only grabbing the cuff that's flipped over. I'm not grabbing the glove at all. Okay, so I'm grabbing the inside cuff so it still maintains the sterility. Then I'm going to grab this. I can grab the inside because this hand is sterile. And I can go ahead and put my hands in this way, but maintaining a sterility like that. So once I have put my sterile gloves on, I have my field to work with and then where my catheter is. So all of this is sterile. This right here, this cath kit, and then this is also sterile. So once I do that, I'm going to grab my catheter, or my drape, my diamond drape, and I'm going to just open it up. And I'm going to look for the shiny side. And I'm going to go not over it, but I'm going to go this way. This is sterile. And then put it over. But my body is not over the field whatsoever. So once I do that, I can get situated by keeping my body far away, but my hands, and I'm using the hands. But this is all sterile, so that should be okay. Then I'm going to get my supplies ready. I'm going to go ahead. I'm minding the 1 inch border around, also keeping my arms nice and tall. And I'm going to put it side by side. Okay? So I can get rid of this by maintaining height, stepping away from the table, and dropping it into the trash. I don't need it. This I can do the same, or this is the name and the information. I can go ahead and I'm going to put it on this, but maintaining the height. I'm going to open these up and take these out. And place them on my sheet, also maintaining height, dropping it waist level. And then I'm going to take my lubrication. I can go ahead and squirt it in here. Okay. So then also maintaining height, I can drop it in the trash that's below me. Then I'm going to go ahead and unwrap my catheter. This is really tricky because it likes to spring out, but the key is to keep it way far away from you and maintain control. So you can see it. I can pull this off, but I'm just curling this in my hands so it doesn't get all spring out on me. And I can place it back inside the box. Okay, and I'm going to drop this again at waist level to maintain my sterile space. So after I've taken this out, I can go ahead and put this on here. I'm going to take this cap off. I can drop it over here, drop it in my trash, just maintaining the waist level. And then I'm going to hook it on to my catheter and make sure that it's on and everything is in the box. Okay, then I'm going to move my set over to the field. So I'm going to take these side by side like this, and then I'm going to drop it straight down where my sterile field. So I'm looking at the 1-inch border as well as the proximity to the vagina. After I place it down, directly down, I'm going to take this hand and it's going to be in sterile because I'm going to spread the labia and make sure that I can identify the urinary meatus. So I'm going to take my cotton swab and I'm going to go around and downward, and then I'm going to go around my sterile field and drop it in the waste bucket that's below me. And then with this Q-tip, I'm going to go to the other side, around and down. Then I'm going to go around my sterile field and drop it. And then with this Q-tip, I'm going to go ahead and go front to back down the center, and then around and drop it. Once I have done that, I'm going to take my urinary catheter. I'm going to put 4 inches into the lubrication, and then with this hand, I can go ahead and insert my catheter. So this hand, or my left hand, cannot touch the catheter at all, and this hand needs to maintain that sterility. So I'm going to go ahead and insert my indwelling catheter. I'm making sure that I'm not touching it at all. So my hand, I don't know if you can see it, is not touching the skin at all. And I'm going to advance it with this hand. And then I can see urine. And once I see urine for a female, I'm going to insert it 1 to 3 inches more. So once I insert it, I'm going to take this hand, and because I'm not inserting, I'm grabbing the tube and I'm going to hold it because we don't want to insert anymore. So we can see urine, and we went 1 to 3 inches. And then I'm going to slowly inject the balloon and say, okay, you let me know if you feel any pressure or pain or anything like that when I insert, as I'm blowing up the balloon. So once I have put in all my cc's, I'm going to slowly pull out, and I'm getting resistance, so that's good. And I'm going to take off this part while still maintaining pressure on the plunger. So once I've done that, I'm going to take the bag and I'm going to put a clamp on her thigh, usually right here, if this were her thigh. It's the Foley catheter. I'm going to put the bag on the non-movable part of the bed below the patient's bladder. So make sure that it's not on the side rails or hooked onto anything like that. Once I have done that, I can go ahead and take all my trash and then take this off and go ahead and cover her back up. I'm going to take off my gloves and wash my hands. And then I'm going to lower her bed and say, Miss Smith, do you need your call light? Would you like your phone nearby? Any personal belongings she wants nearby. But making sure that the bed is in the lowest heights to prevent falls. Once I do that, I'm going to take out this paper and I'm going to document in my Mars the type and the size of the catheter that we use. I'm going to measure I'm going to look at the color, amount, consistency, and and any odor that was in the patient or that the urine had. And then I'm going to document how well the patient tolerated the procedure. And that's going to be it for catheter insertion.